Stroke, also known as cerebrovascular accident, CVA, is a serious medical condition that occurs when blood flow to the brain is disrupted. This can lead to damage or death of brain cells, which can result in various physical and cognitive impairments. Strokes are a leading cause of disability and death worldwide and require prompt medical attention. Types of stroke: ischemic stroke and hemorrhagic stroke. Ischemic strokes are the most common type of stroke, accounting for about 87% of all strokes. There are two types of ischemic strokes, thrombotic and embolic. Thrombotic strokes occur when a clot forms in an artery that supplies blood to the brain, while embolic strokes occur when a clot travels from another part of the body, such as the heart, to the brain. Hemorrhagic strokes are less common, accounting for about 13% of all strokes. They occur when a blood vessel in the brain ruptures, leading to bleeding in or around the brain. There are two types of hemorrhagic strokes, intracerebral and subarachnoid. Intracerebral hemorrhages occur when a blood vessel in the brain ruptures and bleeds into the brain tissue, while subarachnoid hemorrhages occur when a blood vessel on the surface of the brain ruptures and bleeds into the space between the brain and the skull. Risk factors. There are several risk factors for stroke, including 1. High blood pressure is the most important risk factor for stroke. It increases the risk of both ischemic and hemorrhagic strokes. 2. Smoking increases the risk of stroke by damaging blood vessels and promoting the formation of blood clots. 3. Diabetes increases the risk of stroke by damaging blood vessels and promoting the formation of blood clots. 4. High cholesterol can lead to the buildup of plaque in the arteries, which can increase the risk of stroke. 5. Obesity increases the risk of stroke by increasing the risk of high blood pressure, diabetes, and high cholesterol. 6. Family history. A family history of stroke or cardiovascular disease increases the risk of stroke. 7. Age. The risk of stroke increases with age. Symptoms. The symptoms of stroke can vary depending on the type of stroke and the area of the brain that is affected. The most common symptoms of stroke include 1. Sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. 2. Sudden confusion, trouble speaking, or difficulty understanding speech. 3. Sudden trouble seeing in one or both eyes. 4. Sudden trouble walking, dizziness, loss of balance, or coordination. 5. Sudden severe headache with no known cause. Diagnosis. To diagnose a stroke, a healthcare provider will perform a physical exam and ask about the person's symptoms and medical history. They may also order imaging tests, such as a CT scan or MRI, to visualize the brain and detect any abnormalities. Blood tests may also be ordered to rule out other conditions that can cause similar symptoms. Treatment. The treatment for stroke depends on the type of stroke and the severity of the symptoms. In general, the goals of treatment are to stabilize the patient's condition, prevent further damage to the brain, and minimize the risk of complications. Here are some of the treatment options for stroke. Ischemic stroke treatment. A. Thrombolytic therapy. Thrombolytic therapy, also known as clot-busting therapy, is a treatment that involves the use of drugs to dissolve blood clots that are blocking blood flow to the brain. The most commonly used drug for this purpose is tissue plasminogen activator, TPA. Thrombolytic therapy is most effective when given within the first few hours of stroke onset, but it can be effective up to 4.5 hours after onset. B. Mechanical thrombectomy. In some cases, thrombolytic therapy may not be enough to dissolve a blood clot. In these cases, a procedure called mechanical thrombectomy may be used. This procedure involves the use of a catheter to remove the clot from the affected blood vessel. C. Anticoagulants and antiplatelet agents. Anticoagulants, such as warfarin, and antiplatelet agents, such as aspirin and clopidogrel, are drugs that help to prevent blood clots from forming. They may be prescribed to prevent future strokes in patients who have had an ischemic stroke. Hemorrhagic stroke treatment. A. Surgical treatment. If the bleeding in the brain is severe, surgical treatment may be necessary to remove the blood and relieve pressure on the brain. This may involve the removal of a portion of the skull to allow for the swelling to occur. B. Medications. In some cases, medications may be used to control blood pressure and prevent further bleeding. Rehabilitation. After a stroke, rehabilitation is often necessary to help patients recover and regain their independence. This may involve physical therapy, occupational therapy, speech therapy, and other forms of therapy. Rehabilitation can help patients improve their strength, coordination, balance, and communication skills, and it can also help to prevent complications such as blood clots and pneumonia. Prevention. Preventing a stroke involves managing risk factors such as high blood pressure, smoking, diabetes, and high cholesterol. This may involve lifestyle changes such as eating a healthy diet, exercising regularly, quitting smoking, and managing stress. Medications such as blood pressure-lowering medications and cholesterol-lowering drugs may also be prescribed to help reduce the risk of stroke.
Thank you for watching. If you enjoyed this content, be sure to hit the subscribe button on the Healthy MO TV channel and give this video a thumbs up to show your support. By doing so, you'll stay up to date with future content like this. See you in the next video.